When we're talking about exposure to traumatic material, it can have a very devastating impact on kids. And some of that's dependent on the age of the child. So we know that younger kids in some ways are more affected by those kinds of images, just less able to effectively process that information. But we also know that individuals with a history of trauma exposure are going to be more at risk as well. So there's all sorts of different risk categories that we have, but clearly kids in general are going to be at high risk for difficulty being exposed to material like that. And especially in the context of a well-known, well-regarded YouTube personality, who has all of these followers. And I think that's maybe one of the more important issues here, is that the message that might send to kids that this is okay, or it's funny, or it's entertaining, besides the traumatic exposure. I think like all incidents like this, it really is an opportunity for parents, if they haven't already, to sit down with their kids and have a discussion with them about the dangers and pitfalls of social media and YouTube and internet material in general. Because as we've seen with this situation, these things are not well monitored, and if they are well monitored, sometimes poor decisions are made in terms of what information to allow into the site. And so it's a real opportunity for parents to sit down with kids and to discuss boundaries and how parents are going to be involved in managing all of this for kids. Because again, we have a generation of parents basically who did not grow up with any of this, and they're still struggling to understand it and manage it themselves. And so I think this is all about helping kids understand and manage these devices and these types of technology in their lives, because it's not going away. These sorts of things are just going to become more prevalent and more established in our lives. And if we simply restrict kids from using things, then we do them a disservice. And so we don't want parents to be scared, but we do want them to be aware of what's out there and having really very honest conversations with their kids. Fortunately, these events happen regularly enough that there seems to always be an opportunity to do that. I think having had it happen so recently gives it some added importance and salience to kids. But I think whenever parents can do this, it's a good time to do it. We do tend to see what's called a contagion effect sometimes, and that is individuals who may or likely are at risk already for suicide will act on those thoughts and ideation more readily after something like this happens. So I think that there is real danger in that sort of effect from something like this. And again, it presents an opportunity for us to really teach about suicide, to direct people to appropriate resources, appropriate supports, and to make sure that kids, especially those who are at risk in different ways, are identified and supported. Lots of good opportunities for discussions here, as well as just simply acknowledging the fact that teens are going to come across questionable and inappropriate material online in various ways, and to make sure that there is an open pathway to parents for conversations to be had, so there's not an effort to hide or escape some of those things that kids might see, but that they know that if they see these things, then they need to have a conversation with parents about it. So oftentimes kids come across things and parents never know, and that presents more of a danger. And so ideally we have a parent-child relationship where there's lots of open discussion, that there's no shame in discussing anything, which includes thoughts about suicide. We know that thoughts about suicide are not terribly uncommon in children and adolescents. And so we want all of that to come out from the shadows and really become a conversation that we can have with kids. Schools and community leaders, all of these individuals can play a role in helping support kids and educating them on all of this. I think we also need to let parents know that if they see any kinds of warning signs, any changes in kids' behavior or mood, that's probably something that needs to be brought to a professional, at least to a school or religious or community leader, someone who can help that child get the support and further evaluation that they need.